Hi friends, today we are discussing about the prescriptions of children for cold cough with fever. So 5 to 12 years age, remember this age. First, in general, one antibiotic, one cough syrup, one antipyretic, one painkiller, and one antacid. These are the general things we indicated cold cough fever. If there is any shortness of breath, we will indicate theophylline. So first we see the medicines, drugs. Cold cough fever. Capsule amoxicillin 250 mg, which contains amoxicillin. Capsule amoxicillin 250 mg, Novamax capsule 250 mg, Novamax dispersible tablet 125 mg or 250 mg, or Cefix tab 50 or 100 mg, which contains a cefixime, or Mahasef dispersible tablet 100 mg, which also contains a cefixime. Any one of antibiotic is indicated. Then the second one is a cough syrup, antihistamine. Mucolyte syrup, which contains ambrodil tablet 30 mg, which contains ambroxyl, or Tusky DX oral liquid 100 ml, which contains dexamethorphan HBr 50 mg plus chlorophenamide mannan 2 mg plus phenylnephrine HCl 5 mg for 5 ml, or Tusky X plus expectorant, which contains chlorophenamide mannan plus ambroxyl. So 2 are covered in Tusky X plus expectorant. Most probably this is indicated. Syrup ascorbyl D, which contains dexamethorphan HBr 10 mg plus phenylnephrine HCl 5 mg for 5 ml. Triploitin HCl 1.25 mg. So one antibiotic, one cough syrup, which is antihistamine, and the next one, third one is antipyretic for fever. Tab Calpol 500 mg, or Crocin 500 mg, or Dolotab 500 mg, or Tab Macfast 500 mg, or these for the tablets. In some conditions, infusion also indicated. Macfast infusion 1000 mg or Paracet infusion 1000 mg for 100 ml. These two are infusions, these four are tablets, which contains paracetamol. Next, painkiller, which reduces the pain and decreases the inflammation also. Voveran T 21 or 30 or 50 grams available. Diclofenac, which contains diclofenac. Voveran D dispersible tablet 50 mg, or diclofenac injection 25 mg, or diclonac. P means paracetamol. Tab, which contains a diclofenac 50 mg plus a paracetamol 500 mg. If this medicine is indicated, no other antipyretic is indicated because it contains already paracetamol 500 mg. So remember this combination very carefully. Voveran plus tab, diclofenac 50 mg plus a paracetamol 325 mg. Then antacid syrup Rantac 75 mg for 5 ml, 100 or 30 ml available, which contains Ranitidine. Tab Rantac 150 mg, the mostly indicated tablet Rantac. Tab Zintac FC-Tab 150 mg. These two are mostly indicated. Then another antacid also is there. Tab Lupipan 20 or 40 mg. Pansec Tab 40 mg. Pansec injection 40 mg. Pantodac EC Tab 20 mg. Lupipan DSR capsule. So the Pan D, Pantosic D, Pantac D, Pantozet D, these all are contain pantoprazole antacid. So any one of antacid, whether it is Ranitidine or whether it is pantoprazole, will be indicated. If the person having asthma, not exactly asthma, it called as shortness of breath because of a lot of accumulation of the mucus in the chest, lungs. He unable to freely breathe. So in that condition, we will indicate theophylline. Tab Cadifilate 250 mg, Tab Theopa 100 mg or 300 mg, or Tab Theostan CR 200 mg. Deriphyllin retard 150. The mostly indicated drug is deriphyllin retard 150, which contains theophylline 115 mg plus theo phenylphenylene hydrate 35 mg. So these are the medicines, drugs which are indicated cold, cough, fever in children's. Thanks for watching.